Members will call the Committee on Health and Human Services Reform to order, and we have a quorum present. So first order of business is to approve the minutes for April 5th. Do I have a motion to approve the minutes? Representative Mason moves the minutes of April 5th, 2016. All those in favor say aye.
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 Those opposed, no. The motion prevails. Members, first bill on the agenda is Representative Backer's bill, House File 3235. And Representative Backer moves that House File 3235 be re-referred to the Committee on Health and Human Services Finance. We have the bill in front of us. Representative Backer, I understand you have a DE1 amendment?
Yes, we do.
Okay, members, Representative Backer will move the DE1 amendment to get the bill in the order that he would like. All those in favor say aye.
Aye.
Those opposed, no. The motion prevails. Representative Backer, to your bill as amended.
Thank you, Chair and members. House File 3235 would provide for a 5% rate increase to Medicare payments for rural ambulances. Just use the service that I volunteer on the weekends when I'm back in the district, which is the Browns Valley service. We service a 900 square mile area, 3 counties and 2 states. Last year, fiscal year, we were short by $33,000. And that's very common in my district on western Minnesota, other parts in greater Minnesota. As we know, the Medicare and Medicaid payer mix has approached over 80% for some ambulances services in rural Minnesota, as an increase in Medicaid would help greatly with our operational costs. Also is a request for the EMSRB to secure funding for some IT infrastructure that was left out of the governor's budget proposal. And with that, I have Buck here from the Minnesota Ambulance Association to provide testimony.
Welcome to the committee. If you could introduce yourself and proceed.
Madam Chair and members, Buck McAlpin, Minnesota Ambulance Association. As Representative Backer described, this is part of our rural sustainability stuff that we've worked on. We still have quite a problem maintaining the EMS ambulance infrastructure in rural Minnesota. Medicare, Medicaid payer mixes are through the roof. Really not a lot of opportunity to cost shift, or otherwise it goes to the taxes. I have talked to Chairman Laurie, and he kind of brought this topic up to us too over in the Senate this year. So we thought that we would move this forward for this session. Also, you'll see in the bottom under an appropriation, and talking with some folks, we thought this was the best spot to put it. The State EMS Regulatory Board and Executive Director Spector's here if we have more questions on the sake of time. It's a group that's members are very well supported. Representative Backer sits on there from the legislature, and a lot of us and our peers in the industry sit on the board. One thing that we do is we work very closely with them from the trade association to be sure that what they're doing regulatory-wise is supported by us, with especially our rural operations. The funny thing is how we set this board up years ago in 95, 96. It's not supported with special revenue funds like the chiropractor board or psychology board. It's a general fund supported board because still about 62% of our EMS folks are volunteer. So we felt it wasn't appropriate to charge them to volunteer in their communities. So the majority of their budget's general fund. This wasn't included in the governor's budget. I think at times it's even confusing to them how it's set up. But there is some IT needs if they switch the IT system this year that you'll see listed below. And basically the total is a request for about $125,000, $110,000 to the base for the biennium, and $15,000 that we said we'd work on them with for 4 800 megahertz radios. We have a trunked 800 megahertz radio system. I can sit right here and talk to the Browns Valley ambulance service on the portable radio if I want to on 800 megahertz.
You can just talk to me right
Talk to Jeff right now. Executive Director Spector's staff in the outstate have very outdated, antiquated equipment, and they respond to emergencies and disasters for us, and we wanted to add that to an appropriation this year.
Okay, is there anyone else in the audience who wants to testify to the bill? Not seeing any members. Questions? Not seeing any member questions. Representative Backer, final word on your bill?
I would appreciate your support. Thank you, members.
Okay, Representative Backer renews his motion that House File 3235, as amended, be re-referred to the Committee on Health and Human Services Finance. All those in favor say aye.
Aye.
Those opposed, no. The motion prevails. Thank you, Representative Backer.
Thank you.
Thank you, sir.
Members, next we'll take up House File 3305. Representative Kresha, and I will move that House File 3305 be re-referred to the Committee on Health and Human Services Finance. We have the bill in front of us, and we have a DE1 amendment. Is that accurate?
That is
Representative
correct,
Kresha?
Madam Chair.
Okay, so I will move the DE1 amendment to get the bill in the order that the author would like. All those in favor, say aye. Aye. Those opposed, no. The motion prevails. Representative Kresha, to your bill as amended.
And thank you, Madam Chair. And just a quick technical thing. This bill, with this DE amendment, puts it in the exact same shape as it's in the Senate. And that bill has already moved to the Senate floor. I'm just wondering if we need to go to HHS Finance or if we could change the motion to go right to the House floor. And I'll certainly respect the committee's wishes, but I just thought for simplicity, I would bring that up.
Okay, Representative Kresha, staff has informed me that there is no fiscal implication to your bill with the DE1 amendment. So at the end, the motion will be to re-refer
Thank you,
this
Madam
to
Chair.
the general register. Representative Kresha, to your bill as amended.
And thank you, Madam Chair, members. And what this simply does, and I think you're going to hear broad agreement, we're simply asking that in foster care training, that we add 1 hour of fetal alcohol syndrome training. There's no extra burden. It's just part of what the existing training is. And we're not asking for any additional resources. And I'll let you hear from the testifiers. But like I said, I think you're going to hear broad agreement. And I'm hoping this will move forward.
Welcome to the committee. If you could just introduce yourself for the record and then proceed.
Thank you, Madam Chair and the committee members. My name is Michael Harris. I'm a licensed psychologist since 1997, and I'm here to testify on the FASD amendment. My specialty is in reactive attachment, developmental trauma disorders of adopted and foster children, as well as treating and training others on fetal alcohol syndrome. I've also been a single licensed foster parent for 4 years to one boy who just turned 18 a couple weeks ago, and he'll be staying with me even longer now through the extended foster care program. And I am so proud of that kid, and even though I've had a lot of worries about him, he is still in school. He's never been picked up by the police. Nobody's gotten pregnant, and he actually talks to me and even asks me for advice on occasion. By all appearances, he values our relationship. And he's been with me 4 years, but most 14-year-olds who enter foster care at that time have 8 to 12 or more placements by the time they turn age 18 and age out of the system. And I'll tell you why. My son joined me, and there was definitely a honeymoon period where everything was terrific for a few months, but then the challenging behaviors kicked in. A few months later, we had a really big blow up, and after a lot of yelling, he started throwing dishes, which never happens in my life. And that kind of stunned me. And in that moment, in my stunned state of mind, I had this moment of clarity. And I realized that I could end his placement with me. All my troubles with him would end right then and there. And all I had to do was just say one more thing. And I knew he'd explode to the point where his worker would take him out of my home, and it wouldn't even look like my fault. It would look like it was all his fault. Well, I was in that very moment where other parents had told me, as their kid's psychologist, that their placement had failed and that they were giving up. I was right there in that moment, and I knew what was going on because of my experience and training in FASD. That knowledge and that awareness gave me a choice in that critical moment. I had the conscious choice to do something that would end his placement, or I could do something completely different and help this kid get a different outcome than all those others who have had 8 or 12 or more placements until they age out of the system. And usually they age out of a system into another system like chemical dependency or the correctional system. The FASD training is what gave me the awareness, and that's what gave me the choice. Without the training, I would have been in the dark, I would have acted on anger, and his placement would have failed and started this cascade. Most foster parents are not psychologists. Most don't have a clue at all about FASD, and sometimes we don't even when we are a psychologist. But if they do, they'll be better parents and prevent worse, more expensive outcomes for our foster kids in Minnesota. Thank you.
Thank you for being here. Appreciate you sharing your story. Is there anyone else in the audience who wants to testify to the bill? Not seeing any. Members, questions? Representative Liebling.
Thank you, Madam Chair, and thank you to the testifier for that story. It's pretty compelling stuff, and thanks for your work, and thanks for being such a great foster parent. The question I have, though, is the bill requires 1 hour of training on fetal alcohol spectrum disorders. What could you have learned in 1 hour that would have given you, if you weren't a psychologist, if you didn't, I'm wondering about that. Is the 1 hour really going to make the difference between what you did and the people that you saw, that you see as a psychologist?
Mr. Harris.
Madam Chairman, or Chairperson, and Representative, thank you. The 1 hour, the foster care training is not enough anyways, and we're required to have 12, I think about 12, and it's an orientation to many of the conditions and experiences that we're likely to have, including, and also safety issues and things such as that. In 1 hour, what it does, though, is it doesn't teach us everything about FASD, but it puts that awareness inside of us that what I see, there may be something else driving this behavior, right? So it gives me more options that way to seek out and find additional help and additional training or additional support from other foster parents who are more senior than I am, or my social worker who may know more about that. So it's more about a perspective shift, and given the right training, that orientation can actually give a pretty powerful perspective shift. Is it going to give me this, all the skills that I need to do that in that moment? No, but that's part of the learning process.
Other questions, members? Not seeing any. Representative Kresha, final word on your bill.
Madam Chair, all I'm going to say is I hope we can do this quickly, because with my newfound friend of the psychologist, I'm afraid I'll have to start talking about feelings up here. So perhaps we can move this quickly.
Okay, members, I will renew my motion that House File 3305 as amended be re-referred to the Committee on Health and Human Services Finance. All those in favor, say aye. Aye. All those opposed, I'm sorry, Representative Kresha, we discussed it being moved to the general register.
Amending the motion, correct.
Okay, so we are going to, I'm going to go back and I'll just renew my motion.
Thank you, Madam
That
Chair.
House File 3305 as amended be re-referred to the general register. All those in favor, say aye. Aye. Those opposed, no. The motion prevails. Thank you, Representative Kresha.
Thank you, Madam Chair and members. This has been a great committee for me, so thank you.
Members, next bill is Representative Dean's bill, House File 3271. And members, Representative Dean moves that House File 3271 be re-referred to the general register. We have the bill in front of us. Representative Dean, to your bill.
Thank you, Madam Chair and members. This is just a simple technical correction bill that just updates the food support and food stamps to the SNAP program and legislation. That's all it does.
Okay, is there anyone in the audience who wants to testify to the bill? Not seeing any. Members, questions? Representative Liebling.
Thanks, Madam Chair. Representative Dean, does this bill have wheels on it?
Representative Dean.
Madam Chair, Representative Liebling, I don't see any in the legislation.
Members, other questions? Not seeing any other questions. Representative Dean will renew his motion that House File 3721 be re-referred to the general register. All those in favor, say aye. Aye. Those opposed, no. The motion prevails. Thank you, Representative Dean. And members, that concludes our agenda for today. And at this point, for the foreseeable future, concludes our agenda for the session, barring any catastrophes that need to be dealt with or last-minute events. And so I just wanted to briefly just take a minute and first say thank you to everyone here for serving on the committee. Everybody who spent any time on Health and Human Services knows that I think it's one of the toughest committees to serve on, and the issues are never easy and never black and white. And so thank you for the commitment to being here and to thinking about these issues and going about it in a thoughtful process. I really appreciate the respectful nature with which everybody sits on this committee. And I want to thank House Research, Danielle Punelli, Randy Chun, Lynn Aves, and Elizabeth Clark Fisk, thank you so much for the hours and the time that you put in to equip us, answer our questions, and help us make the best decisions possible. It's truly appreciated. I want to thank the researchers, Bethany Dorobiabla and Leah Montgomery. Thank you so much for the work that you do to try to help move things smoothly and help all of the members. Thank you to the pages, Lauren and Jim. Thank you for the time that you've put in to keep us organized and get us everything that we need, and we really appreciate your service and the time you've given. And I want to thank the DFL lead, Representative Mullery. I think he had to step out, but I just want to thank him for his leadership, as well as the Vice Chair, Roz Peterson. Thank you for stepping in when I've needed you. It's really appreciated. Thank you to Emily, the CLA, who does a phenomenal job and puts in extra hours to make sure everything gets taken care of. And to Carmen Mayo, who unfortunately hasn't been able to spend much time with us this session due to some medical issues. She was the designated committee administrator, put in a lot of time before session, hasn't been able to be with us during session, but just want to give her credit. And then to Holly Iverson, who has done the lion's share of work and has been the administrator for 3 committees in one session, which anybody who's been around this committee knows that's a really heavy lift. And so I am indebted to her for a tremendous amount of work and keeping me on my toes and never letting me be surprised. So, to Holly. And to all the advocates and the lobbyists, you're a pleasure to work with, and it's been an honor and a privilege. Thank you for an incredible session. Thank you for the incredible honor of getting to chair this committee, to the leadership who put me in this position. It's one of the great honors of serving at the legislature, and I've truly enjoyed it. I've learned a lot from everybody around this table and the people that have gone before me, and look forward to continuing to learn about issues that are important to the people in this state and the critical decisions that are made here. So thank you to everyone. I appreciate it. And with that, the Health and Human Services Committee is adjourned.